So the second part of our webinar series on healthcare. This is the second part of our webinar series and focuses specifically on resume customization, and will be presented by myself and my colleague Tamar. So the webinar is being recorded currently, so please feel free to turn off your cameras for the duration of the webinar. All participants are also going to be muted upon entry, so please feel free to drop any questions that you have in the chat, as we'll be keeping an eye on those. The last webinar that we had, we have a recorded version of that available as well, so you can ask your job coach for a copy of that, and we'll also be sending out a recorded version of this webinar later on today. So before we get started, I wanted to introduce the team. So I'll start off. My name is Kiri Philbrook, and I'm an Employment Services Advisor for the New York region, working specifically in the healthcare community of practice. And I'll be presenting with my colleague Tamar.
Hello, I'm Tamar. I am a job coach in the Chicago office of Upwardly Global, working in the Central Region, and I'm also the head of the Healthcare Community of Practice. And I'm so glad to see so many people today, and I'm gonna pass it to my colleague Layla.
Hi, everyone. Very happy to be with you here today. As Tamar said, excuse me, my name is Layla, and I am in the Western region in our San Francisco and Silicon Valley offices, but also work with Washington State job seekers. So very excited to be with you here today.
Hi, I'm the last one here. I am Patty or Patricia Reshton. I'm Employment Service Advisor in the DMV region. I've been with UpGlow already for 5 years. And yeah, I'm very excited to be here today to part 2, and I hope you all will enjoy it as well. Thank you for being here.
I'm Rebecca Fishman. I'm the Healthcare Pathways Advisor. We're happy you're with us today.
Thank you so much. So first, I'd like to just go over what we're going to be covering today. So first and foremost, we're going to go over what exactly a customized resume is. We'll discuss applicant tracking systems and JobScan. We'll go over how it is exactly that you can work on matching your resume and what that specifically looks like in healthcare, as well as high demand skills that are good to have on your resume and the importance of network. And we'll finish the importance of networking. And we'll finish off with an interactive activity around customizing resumes. So first and foremost, what is a customized resume? So it's a resume that's written in response to a specific job posting. So if there's a job that you're interested in, you would look at the job description and you would customize or match your resume as best as possible to that specific job description based on the qualifications, experience, educational background, skills, and so forth that they are putting as requirements in the posting. And it's to ensure that your qualifications and your experience match up enough that a recruiter can see how all of your transferable skills and background are relevant to what they need for this position. So applicant tracking system is a database for job applications. And when you apply to a job and upload your resume, often the resume and the application go through this software, and it can filter out applications that don't have a high match rate to the job description. So if there isn't much on your resume that seems to be applicable or to match the job description, ATS, applicant tracking system, will automatically filter out your application, and then it won't actually be seen by a recruiter. So we want to keep this in mind when it comes to customizing resumes. And a good resource to check whether or not your resume would potentially be filtered out by ATS is to use a website called JobScan. and the link is here. I'll be sure to send it out after the webinar is done. And what it is it's a website where you can upload a job description and your resume, and it will compare your resume to the job description, and then will give you a percentage and some numbers on how well your resume stacks up or compares to the job description, which can help you then fine tune your resume further to make sure that it wouldn't be filtered out. So in the next slide, I have an example of what this looks like. So if you upload a resume and job description, first what you'll see is this. It shows you your overall match rate. We can see here that this score is pretty low, and then it gives us some information about what it is that's missing. So when you're on this website and you scroll down further, you'll see different sections for ATS findings, recruiter findings, skills match. It'll tell you which skills need to still be added in, what might need to be edited to be higher, to have a higher up match score for ATS. And it's a valuable resource when figuring out how much more you might need to customize, or if you've already customized enough and it's looking good. So the elements of matching your resume and customizing your resume involve looking at the different sections of your resume with the job description alongside, and then seeing everywhere in your resume in every section where you might want to change the wording, add skills in, or change titles in order to have your resume match very strongly. So in the professional summary, you might change your title. If you're, for example, if you're applying for a research job and your background is not so much in research, so your current title is doctor or medical assistant or any other area, you would change the title in your professional summary to match or to be more similar to the title listed in the job description. And you would look at the key skills listed in the job description and add them in, or as many as are applicable to you, into the key skills section of your resume. As well as that, in your job section where you have the bullet points for each job, you might want to reword or reprioritize some of the bullet points just to better show how you have similar skills or have similar experience to what's in the job posting. And it's important to keep in mind that when making these changes, it's not about making things up or misrepresenting yourself, but just about highlighting what's relevant, because when a recruiter looks at your resume, they want to see what's most important, what's most relevant to them in the job description. And the easier you make that process, the easier it is for them to see how you could be a good fit for the position.
Thank you, Kiri. I wanted to take a moment just to, before we specifically dive into the healthcare resumes, to see if there were any questions, anything that's not clear. We're going to go into more detail now, but really wanted to pause for a second. So if you have a question, feel free to put it in the chat. Okay. Oh, good question. So Nina asks, Kiri, do you know what is a good match rate on JobScan?
Yeah, so typically I recommend that people aim for 80% or more. I've found that it's nearly impossible to get 100% and very hard to get above 90 or so percent, because they are a website that has subscriptions, and they ask that in order to unlock some extra information that you pay for a subscription. So I find that once it's at 80% or above, it's right where it should be, and that's typically what I recommend. I don't know if Tamar, Patty, or Layla have a different recommendation or ideas about that.
No, just a second, Kiri, that's totally correct. It's hard to get even 80%. Sometimes you have to use JobScan with a little bit grain of salt. And getting those 80% is already amazing when you have it. Even 76, 77, but yeah, that's the matching rate that we recommend.
Okay, so talking specifically about customizing healthcare resumes. So I really want to encourage you all not to think about your resume as your life story. I think in other cultures, perhaps, that can be kind of the approach. And I like to think of it as a marketing document. And I really, this is healthcare, so we're not also familiar with marketing and marketing terms, but I want to encourage you all to think about your job search as a marketing campaign. And so how does the resume answer the question, why I'm qualified for this job? And how does that go and fit with the networking you're doing to build your network and your connections in this field? And it goes with your LinkedIn profile, and all of it fits together to say who you are, which can be challenging. I know for many of you, having taken a quick look, I know a lot of folks on this call right now are doctors, are not looking for jobs as doctors. And really, how do you think about your identity as a healthcare professional, a medical professional, a research professional? How do you make those career pivots and tell that story in a coherent way? So that's something we work really hard with you all to do, but it's also something you've got to really embrace in your own career. We're providing a lot of support for folks now who are studying to move into clinical research. And that's an area that we think there's a lot of opportunity and growth, but how you make that pivot and how you let the employers know that you're really interested and qualified for these research jobs. So this is something we'll be working on together. And this is a first crack at sort of how you tell that story. For a lot of folks who come to the US with training and experience in healthcare as doctors, as pharmacists, as dentists, you have an identity, and those aren't the jobs that you're applying for at this point because you're not licensed. So as you may be on the path to being licensed or deciding you not to relicense, you have to figure out how you fit yourself into another role and address the first question, which when employers see your resumes are, you're overqualified. Why are you applying for this job? So as Kiri said, it's a lot about looking very carefully at that job posting. And when your gut says you can do it, how do you make the connection in the resume? How do you help the resume to say, oh yes, this is what I can do? So we would never recommend that you lie in a resume, but de-emphasizing things, taking details or experience off, that's not lying. That's simply saying, this resume asks the question, why am I qualified for this job? And this is what I'm going to share with you. So we'll talk about that more in detail, but really wanted to put that out there that, that this can be a little bit challenging. We don't have all the answers, but these are the kinds of questions that you want to be thinking about as you're working on customizing your resume. So in addition to the challenges you face, you also all have really fabulous skills that are in very high demand in the healthcare industry. Most of you are bilingual, if not multilingual. You have experiences living and working in other countries. In the United States, that is becoming there's a huge conversation now about how healthcare can address the communities that we're providing healthcare for. So already you all come with a really great advantage that you can reach other immigrant communities with those skills. You all have excellent clinical skills if your practice has been clinical, that we know are in demand even when you're challenged because of the licensing and regulation requirements. So thinking about how you can present those skills. Many of you have public health skills, have learned public health as part of your training, have worked in countries that have faced, crises and challenges like Zika, like HIV/AIDS, tuberculosis, all sorts of healthcare challenges, and many of you can highlight that experience and those skills. Many medical professionals come to the work with experience in clinical research, something that even if you've only been exposed as part of your education, that's something that you can talk about and highlight. If you have IT skills, data analytics, computer skills, experience with electronic medical records, data and analytics related to research, any of those things, we also can highlight those. I know for many people that hasn't been part of their journey to this point, but if those are areas of interest, we can also help you develop those skills, identify training opportunities. So really thinking about those hard skills that you have that can be transferable and used in different settings. So that's a very important thing to think about, and to think about continue to build these skills. So I know we're talking resumes here, but as I said, when I started talking, I really want to emphasize for folks in healthcare, many of you are looking for jobs that are very different from the jobs you've done in the past. And employers have a certain idea, often when you're looking for a more entry-level job, that the applicants will be very young, straight out of college or community college with limited experience. So one of the ways that you help employers to understand your applications is to build your network, and also to learn from the experience of others who are in similar situations. It's so important that although sometimes it feels like employers don't know, we know there's a huge community of healthcare professionals who are looking to make these pivots, to contribute to the US healthcare system, to build on your skills and training and expertise. So we want you to connect with each other, to connect. Hopefully we're providing opportunities to connect with alumni who can share their experience and how they have dealt with some of these challenges, and then also networking with employers, helping them to understand. That's something that we do a lot of work with. That is why our friend Rebecca Fishman essentially is on our team, is helping us to connect with employers, to make the case, help them understand the backgrounds that our job seekers come with, and then help them understand why it is to their advantage to hire folks like you. So you too should be out there trying to build your networks. You should be using Slack to connect with each other and post questions. If you're able to, think about doing some volunteer work. That's a great way to build your network and your experience. I know it was really difficult during COVID, but hopefully as things return to a more normal status, we will have more opportunities to volunteer and to network. So I think that's really an important piece of this job search, and even thinking about the resume, is hearing from others to get that feedback. And remember, your resume is a living document, and as much as we, your coaches, work with you and want to help you and want to provide our knowledge, we are not experts on working in healthcare field. So getting that advice from others in the field is really valuable. We will not take it personally if you get advice that is different from ours. We'll talk together and try to understand why that advice is useful and help you incorporate it in your resume. Kira, you want to take the activity?
Sure. So this is an interactive activity. I'm hoping everybody will participate. So what we have here is on the right, we have a job description for a clinical research coordinator position. It has the qualifications, overview, primary duties, as well as the educational background that's needed. Then on the left, we have a resume that has all the identifying information taken out, and it is the original foundation resume. So what I'm hoping is that we can look at the job description, take a look at the resume, and then drop in the chat any ideas you have about what might need to be changed or added or updated, reworded with this resume in order for it to be more customized to the specific job posting. So we'll give everybody 5 minutes to read through those 2 documents and to start dropping your ideas in the chat.
Can people see the documents? For some reason, I'm not.
I'm able to see the documents.
Hmm.
Others in the chat are saying they can see it, but several more are saying that it's small.
Hmm. Is it legible for people, or is it so small that they're not able to participate?
So they say the resume is small. Kiri, is it possible that you make your screen bigger,
I have
larger?
full screened. I don't think I can zoom in. Let's see. Not sure how I can make it bigger. If anyone has ideas.
Do you have the resume maybe saved on your computer, and just maybe you could open the resume?
I don't have it with the information taken out.
Got it. Okay.
Yeah. But maybe I can.
Someone says you could do Control Plus. Try it.
Yeah, I'm trying that. It's not working. Wait, let me see if this will work. Maybe if I just make it bigger on here. Is that better?
Yes, I think that looks better.
Okay, good. All right, so we'll give 5 minutes from now, and then we'll check in. Please feel free to drop anything in the chat as you notice it.
Kiri, we're getting a request to repeat your question or the activity.
Sure. So what we're doing now is we want to take a look at the clinical research coordinator job posting. This is a sample posting. And this is someone's foundation resume. We want to take a look at both and then make suggestions for how the person would be able to customize their resume according to this job posting. So examples are, if you notice any key skills in here that could be added, if there's anything you would change in the professional summary. Anything you would change about education or the different jobs listed?
So someone said the resume would need to offer information connected to the position details.
Definitely. Yeah. What are some ways that we think we could make this professional summary sound a little bit more clinical research aligned?
So we're getting suggestions to kind of add the phrase seeking to advance in clinical research, for example.
Mhm. Yep, that's a great suggestion. Also, if you notice anything in the job posting that you think is relevant that should somehow be worked into the resume, feel free to throw that in the chat as well. If there's any skills or experience you notice that you think should be somehow transferred over.
Also, to just jump in, I love that it was a motorcycle. Kira mentioned wonderfully that the professional summary is very important as well. Is there anything that you guys think could be changed in a professional summary, starting from the title, for instance, giving just a few hints? And someone just wrote, the key skills should add clinical research management.
Definitely. What other skills do we think would be necessary? So when we look at this job posting, and we look at how they're explaining this role, for example, here, assisting in activities related to clinical research studies, administering lifestyle questionnaires, grant applications, IRB for submission and filings, maintaining source documents, ensuring accurate and complete compilation of data. So these are all skills, or most of these are skills that it's likely that you might have some experience that is related to these skills or the same as these skills. So in that case, you could add some of that into the key skills section. For example, if you've helped with preparing grant applications, you could add in grant writing. If you've helped with documenting and doing chart reviews, you could add in chart reviews, documentation, specialists, different skills that are related to everything they list here is a skill that they want you to have. So let's think about how are we going to show them that we have all these skills or that we're able to do everything they listed here. Another thing to look at, the main qualifications says bachelor's degree and at least 1 year in clinical trials or research. So when we jump over to the education section on the resume, we might want to think about whether having these 2 other degrees that are above a bachelor's, if that, might not be necessary or relevant information for the recruiter. And we might want to think about changing that.
We have a comment. Is highly motivated, team-oriented necessary, since that should be an expectation? Maybe that could be stated somewhere else.
That's a very good suggestion. Yeah. Yeah, if we want to shorten down the professional summary and have it be short and sweet, as clear and to the point as possible, we might want to take that out and have some more room for emphasizing further that the clinical research skills that this person has. So that's a great suggestion. Any other ideas before I hop to the next slide?
We have a question,
Mm-hmm.
and the question is, can we just put in the skills section clinical research management? I think this will involve all the duties in research, or should we put the skills one by one?
That's a good question. So it depends on a few different factors. In this case, if you were going to add on these skills and you wanted to keep it brief and not have too many skills listed, then you might want to have more general terms such as that included. But it's important to keep in mind also that if your application is going through ATS, ATS is going to be looking to see if those skills are listed. The thing is, though, is they don't necessarily need to be listed in the key skills. It's always possible to demonstrate those skills with similar wording in your job descriptions in these bullet points down here. So it is possible to have more general key skills and then go more into depth on the specific technical skills in your job descriptions on your resume. I don't know if anyone else, Tamar, Patty, or Leila have ideas on that.
Yes, so I want to second that research management can mean a lot of things. So when they say in a posting, recruiting and screening patients, collecting data, informed consent, you know, that's the kind of language that helps the employer know that those are the things you specifically know. So my inclination is, as Kiri said, either in the key skills or under the description of a specific job, that you add some more specifics to, and Kevin made a really good comment about numbers. It's very helpful to understand the scope of someone's work, the size, and quantify where possible, you know, what kind of research, how many studies, how many people, oftentimes for doctors giving a sense, you know, of how many patients they saw. So very important to think about, you know, how do you tell in the resume in relatively few words the most about your experience, and when a few words can really help specify what that means. So I think that clinical research management is probably too broad.
Exactly. I second this, what Tamar just said. And what I usually recommend is, if you would like to add this in a key skill section, do categories. Like I recommend to my job seekers categorization. So let's say research management, and then you would explain in a few more bullet points under the key skill section what exactly did this include, and you would use the same wording, the same examples from the job description, so a recruiter knows exactly, oh, okay, this includes this, and this is exactly what we are looking for.
Thank you so much, Patty and Tamar. If there are no other comments or questions, I can jump over to the next slide where we'll have comparisons side by side of the customized resume and the foundation resume. Okay. So I'm going to go ahead and make this bigger before we look at it. So here we have the original resume that was on the previous slide. And then on the right, we have a sample of what this resume would look like customized to specifically match the job posting from the previous slide. So some changes that were made, as you might notice, are the title was changed. So instead of international medical graduate, we changed it to emerging clinical researcher and international medical graduate. Here it says 5 years of experience specializing in dermatology. Here we put 3 years of experience in clinical research specializing in dermatology. And you might notice we also changed the key skills. So some of those skills that were listed in the job posting were then brought over to the key skills section here. And the descriptions themselves for the jobs are different as well. So whereas on the original resume, there's more of an emphasis on the medical and clinical services that this individual offered as a dermatologist, diagnosing, performing treatments, referring patients. Here we've deprioritized and de-emphasized that. We put that at the bottom. And instead what comes up first is the skills that are more relevant to this position. So participate in activities to plan, measure, and assess and improve the quality of care, communicating across these different teams, ensuring that there's enough supplies available. So we've changed the wording up a little bit on that. And then we added in information into these two sections. They're both longer now, to pull in some of the experience from the job description. So here we added in conducted and supervised research trials with students and ensured all research data was collected following the required research protocol. So very similar wording to what's in the job description. Developing and administering research questionnaires. We also added some of that in here, coordinating clinical research projects conducted by students. And you might also notice that we changed the education section. So because the recruiter or the company is looking specifically for someone at bachelor's level, in order to not appear overqualified, we wanted to only include the educational background that is most relevant to the position. So we left Bachelor of Medicine and we took out the degrees that came afterwards. And the professional development section was left the same, but in cases where you might have courses or trainings that are not relevant to the job you're applying for, you might want to take some of those out. Is there anything else that people noticed that was different, or any other ideas on what could be changed or tweaked further?
Does this make sense to people? Is this similar to what folks have been doing on their resumes? Is this adding some more understanding?
I have one comment. And the comment is, usually a consultant dermatologist needs an MD, but I'm not sure how it works in the US.
Yes. So for this person who was trained internationally, the Bachelor of Medicine is an MD, but you know, that's the name that it's given internationally in many countries, and it feels more in line for, especially for research roles. Everyone's busy integrating this new information, getting themselves thinking about how to customize their resumes, being superstars.
I would like to add something because this is amazing. I think customization is just the step besides networking for your success in the job search. It's critical. And I just want to say, like, Tamar and Kiri already covered everything, but just as an add-on, what I always say to my job seekers is, imagine you go to a store and you have a specific image or your specific goal to buy a product. You know what the product needs to have, what it must have, and what it could have, what is nice to have. And you have a list and you find the product and you're like going through your checklist. Okay, does it have this? Does it have this? It does not have that, but oh, it has the bonus skill, or it has the bonus function. So this is how a recruiter does the same with your resume. Keep this in mind when you customize, like you really want to add what the recruiter is looking for, because the recruiter will, first of all, the software will do it. Then once your resume goes through the software system, a recruiter will go through it, and then he will basically go through the checklist. Does he have the requirements with the same wording? Oh, yes, he has, or she has. Then preferred skills. Preferred skills are the bonus skills. Oh, wow, she or he has those too. So just have this kind of when you customize in your mind.
Thanks, Patty. That's helpful. We didn't go through all that in as much detail. I like that image of going shopping, and really important to differentiate those, because what's required is required, and then as Patty said, that those preferred skills and those things that you can add on really can strengthen your resume if you meet those basic requirements.
If there are no more questions or comments, we just wanted to thank you so much for attending. We'll be sending out an email afterwards that has the recording of the webinar and also the link to JobScan. So thanks so much for attending, and if you have any other questions, please don't hesitate to drop them in the chat now, but we'll be happy to answer them.
There's one more question. I think if in the interview they ask about any other higher education training, does it mean we should avoid saying higher study in dermatology, right?
So I would not lie in an interview. I would certainly, if they asked explicitly in an interview or on an application, I would be clear, and I might say, I didn't include it on my resume, but because it wasn't relevant to this position, but in fact, I do have some additional training in lasers. So thinking about, we believe and know how important being truthful on a resume is. Changing a job title is one thing, but changing what you did or have done is really, really not frowned, is frowned upon. And we want employers to know that, the folks we work with are truthful. So work with your coach to help you have that conversation and be prepared to answer the question of why you're applying to a job if you're overqualified.
Thank you, Tamar. We have another question. And the question is, so just to explain additional things in our education, we could use cover letters?
Yes, you could use cover letters, or you could just wait if it comes up in an interview to say, you know, this is something else I'm doing. I'm not sure I did. I'm not sure it's relevant. You know, the goal is to have a coherent story. And so, you know, if it's not relevant, it doesn't have to be in the resume. You can use a cover letter to kind of tell more of that story. Does that make sense? Patty, Layla, Kiri?
Yes, cover letter is always good to explain more and to show a little bit more about yourself than it's just in the resume. So use the cover letter, make it short and concise as well. And of course, the cover letter needs to be customized as well. So just make sure to keep it short and show if there's anything you want to explain, you can add it in the cover letter.
Great. Another question we have is, if I'm a student in a master's program, should I mention that?
If it's relevant to the job posting, then you can add that in the educational section and add that you have that degree in progress. But if you don't feel that the program that you're attending is relevant, then it's okay to leave it off of the resume.
Think about how you would answer a question in an interview about that. You know, how does that master's hopefully is part of your goal academically. So once again, it's about thinking about how you tell a coherent story about your past experience, your past training, your current experience, your current training. How does it all fit together? So that's something, you know, that we as job coaches are happy to help you with. But also to know on a resume, leaving something off is not, it's your discretion.
Great. And we have another question. Are there other criteria other than having a good resume to get a job? For example, I'm concerned about my name. I have a long name.
I have a long name too. I once had someone ask me, do you think I should change my name? And I said, yes, you should make it longer. I think that your identity and your name is who you are. In the United States, we have a lot of laws against discrimination based on country of origin and race. But if you're not comfortable, certainly there are ways to include a nickname or a name you use. If you feel like that's holding you back from getting a job that you want. But another thing that we just know is how important it is to be networking and talking to people so people can say, oh, that Tamar with that funny long name I can't pronounce, she's really good. We want to hire her.
Exactly. Just to add on this, in regards to the name, I do work with a lot of job seekers who use nicknames or shorten their names. Please make sure if you do so, if you decide to do so, it is consistent. So in your email, a signature or whatever, just make sure it is consistent and if you change your name, make sure it's visible in other resources that you're sending to the recruiter as well.
100%.
You might also want to update your LinkedIn. If that's the name that's on your resume, you might want to update your LinkedIn name. And then in your email address, when you send an email, it comes up with the name first usually that you've input and then the email address. So it's good to edit that in the settings also. So when they get an email from you, they recognize who it is if they've been addressing you as the nickname.
I love that. Thank you, Kutal. I totally agree that a complicated long name can be an icebreaker, something to talk about. don't be afraid to say, hi, my name is Tamara Frolickstein Appel. Glad to meet you. So you make it less of a challenge for them to pronounce. Any other questions before we say goodbye? We're very glad to have done this. We really appreciate that you all logged on and look forward to seeing some amazing customized resumes.
Thank you so much, everybody, for joining us. We'll be sure to send that email out afterwards.